Today we are going to learn more about the skull. How the skull journey start with the proper landmarks. When we move on the road, we are going to travel. We use the Google map with the landmarks so that we can easily reach at particular place. Same that we have some important landmarks on the skull which is very important to learn for the treatment also, so that we can keep our hand movement on particular that place. So we start with, there is a one landmark above the nose, that is the nasion. Then we move forward towards the frontal bone. Here is the one mark that is called the glabella, like we applied the tilak on our forehead, that is the glabella. Then we move forward, there is a point which is called the bragma. After the bragma, we move forward. In the center of the skull, there is a vertex, which is the center point. And then we move towards the back side. There is a Y shape. You can see it there. There is a Y shape. Here is the landmark that is called the lambda. And we move here. There is a astion. And towards the temporal, and between the temporal and parietal region, there is a patron. So these are very important landmarks which gives the proper idea for the skull journey. So now there are some important lobes which we can see externally on the skull. These are the first is the frontal side. There is a frontal lobe that we can see it on our, that is a frontal lobe, which for further we move towards, there are two lobes, that is the parietal lobes, that is are in a pair. Then there is a temporal region, that is temporal lobe. Both the side we have the temporal lobe, and in the back side there is a occipital lobe. So these are a very important lobe, and these lobes are divided with the help of the sutures, as the barriers in between the roads, which uh, gives the proper idea from which side we have to go, the left side or right side. So the same, there are the sutures which divides all the bones of the skull. There is the first suture, that is the coronal suture, which divides the frontal lobe to the parietal lobe. There is a long suture that is in between the both the parietal lobes, that is called the sagittal suture. And in the back there is a suture which the occipital to the parietal bone which divided, that is called the lambdoidal suture. So these are very important. And same here is the temporal and the mastoid bone, temporomastoid suture. And there are so many sutures which divides each bones from each other: zygomatic, mastoidozygomatic suture, and the zygomatic to maxillary suture, maxillary to mandible suture. With the facial bone, in all the facial bone there are so many sutures which divide each other. So this is all about the sutures and the lobes and the surface landmarks. Thank you.